Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them in no time. Today, we're diving into 4 lesser-known gram-negative rods that can cause real trouble. Let's start with these guide questions. What organism causes pink-tinged contamination of bathrooms and soap? What cystic fibrosis-associated bug can survive in disinfectants and cause outbreaks? Which bug causes fever and lymph node swelling after contact with kittens? Which hospital-acquired gram-negative rod is intrinsically resistant to carbapenems, but treated with co-trimoxazole? The microbes in this group aren't your typical enteric pathogens or classic hospital superbugs, but they can infect immunocompromised patients, people with chronic conditions, and even healthy hosts, especially when the exposure is just right. Let's break them down. First is Serratia marcescens, a gram-negative gut microbe. Serratia most often infects patients in the ICU, especially those with urinary catheters, ventilators, or central lines. The bug can cause catheter-related UTIs, pneumonia, sepsis, and wound infections in these patients. Meningitis or endocarditis can also arise, though rarely. Serratia is known for forming biofilms on plastic and producing a red pigment called prodigiosin. This pigment explains the pink coloring that sometimes appears in sinks or soap dishes, which is a classic Serratia clue. It also has digestive enzymes like dinases and proteases that help it invade tissues and resist immune responses. On nutrient agar, you might see red or pink colonies, especially at room temperature. It's oxidase negative and a slow lactose fermenter. As for treatment, Serratia can resist first-generation cephalosporins and ampicillin. Stronger options like cefepime or carbapenems may be needed, depending on the antibiotic sensitivity results. Next is Burkholderia cepacia, a major concern in patients with cystic fibrosis. These bacteria can survive in disinfectants, saline, and even nebulizer equipment. They also make biofilms as well as efflux pumps and enzymes that wipe out antibiotics. They cause chronic infections in people with CF, including cepacia syndrome, marked by fever, rapid respiratory deterioration, and shock. B. cepacia is an aerobic, non-fermenting oxidase-positive bacillus. Culturing from sputum may require special media, such as B. cepacia selective agar. This microbe is highly resistant, so you'll usually need combination therapy tailored to sensitivity results. Next is Bartonella henselae. Unlike the others in this group, B. henselae isn't a hospital-acquired pathogen. It causes cat scratch disease, which typically affects healthy children or young adults after a scratch or bite from a kitten. Patients develop fever and localized lymph node swelling, usually near the scratch site. In the immunocompromised, especially those with HIV, B. henselae can cause abnormal blood vessel growth in the skin, liver, and other organs. Disseminated disease can also arise. Bartonella has adhesin A to stick to host cells and promote angiogenesis. It survives inside macrophages and evades the immune system, especially in immunocompromised hosts. B. henselae is a pleomorphic, fastidious gram-negative bacillus that lives inside cells. You can detect it via serology or Wörthen starry stain on tissue. Azithromycin is appropriate for mild cases. Doxycycline, with or without rifampin, is given for systemic infections. Next is Stenotrophomonas maltophilia, a gram-negative, non-fermenting, oxidase-negative bacillus that thrives in hospital water systems and colonizes plastic devices. It's seen in patients staying in ICUs or undergoing cancer treatment, especially those with central lines or on ventilators. S. maltophilia causes ventilator-associated pneumonia, catheter-related bloodstream infections, and UTIs. This opportunistic pathogen forms biofilms on hospital equipment and produces metallo-beta-lactamases that make them resistant to carbapenem antibiotics. But it's usually sensitive to co-trimoxazole, which is the first-line treatment. That unusual pattern, carbapenem resistance with co-trimoxazole susceptibility, is a key diagnostic clue. Let's review our questions. What organism causes pink-tinged contamination of bathrooms and soap? Answer: S. marcescens. What cystic fibrosis-associated bug can survive in disinfectants and cause outbreaks? Answer: B. cepacia. Which bug causes fever and lymph node swelling after contact with kittens? Answer: B. henselae. Which hospital-acquired gram-negative rod is intrinsically resistant to carbapenems, but treated with co-trimoxazole? Answer: S. maltophilia. Got all four? Stellar! If this video helped you understand this group of microbes, tap like, share, and subscribe. Check out the downloadable summary table in the description. Thanks for watching.